living with that just had to be a nightmare.
This week's stories from Bondi Vet.
As soon as we look at the x-ray, we can see he's only got one of them, and he's supposed to have two.
Oh, poor girl. Look how wet you are. You need another bath. She leaks urine.
Aku has a bladder stone, and a large one.
So that's his bladder there then?
Yeah.
And my goodness, can you see how many stones he's got in?
There's tons.
North of London, young puppy Pippa and her family are getting ready to head off for their appointment at the Royal Veterinary College.
The children adore her, and she definitely makes the house even happier because you're greeted with this bouncy little puppy and they absolutely love it. They really do. Good girl, Pips. Good girl.
Little Pippa has a serious medical condition, and playtime isn't as much fun as it should be.
Oh, poor girl. Look how wet you are. You need another bath. She leaks urine. One of her tubes isn't going into her bladder and it's coming straight out of the urethra, which means the urine just leaks out, which is very unpleasant for her and for us. Let's give you a wipe over, get all that smelly wee off you. Smelly wee-wee. You know, new puppies, you want to cuddle them and love them, and at the minute we just, especially the children, I feel like they can't do that properly at the minute. Come on, baby.
Pippa has already undergone extensive testing at the Royal Veterinary College, and she's booked in today for corrective surgery.
Come on, Pips.
So the procedure that the RVC specialists are going to perform on Pippa is called a laser ablation. And what's super cool is that most dogs will become continent immediately after the surgery. It's awesome.
Hi, Miles.
Hello.
Hello.
How are you?
Nice
to see you.
It's time for the young family to hand Pippa over for her surgery.
I will not be able to stop thinking about her. It's like we've got a fourth baby. Give it cuddles. Bye, Pips. Love you, baby. See you soon. She's going for a little operation, so we can't wait for her to come home after. Good girl. Don't get upset. She'll be fine. She'll feel better.
The benefit of the laser ablation procedure is that it's minimally invasive and associated with short recovery times, so that makes the whole experience a lot less stressful for Pippa.
A microscopic camera has been inserted up into Pippa's body to show the team exactly where the problem is.
So what we're looking for is the opening of Pippa's left ureter, which is the tube coming down from the kidney into her bladder. And in Pippa's case, that opening is in the wrong place, and that's what we're trying to fix.
My belief is that this is the opening into the ectopic ureter, and that is the urethra up there. And you can see urine coming out.
Professor Hattie Syme is leading the surgical team.
Okay, we're on standby. Do you want the energy up?
I think we can go with 1 and maybe 10 to start off with, please.
So this is the exciting part of the procedure. This is where we can see on screen the laser beam that's cutting away the excess tissue that's causing Pippa's ureteral opening to be in the wrong place.
It's just a bit messy at the moment because we've got a bit of a blood clot, but that's not unexpected because what we're doing is cutting tissue. So maybe come back and have a look from a distance and see where it is relative to the urethra.
If the laser has done its job, it will mean no more leaking urine for Pippa.
Yep. Yep.
A special dye is now being used to test the repair.
We can make sure that the ureter is entering in the right place. We can stop there. It's clearly in the ureter and there's clearly no leakage, so we're very happy.
Make you smell nice.
With the surgery complete, it's now time to wake Pippa up.
You can wake up now. Come on, baby girl.
She'll be closely monitored overnight.
So we're just going to go and pop her into the incubator because she's a little bit chilly.
A big test will be whether she stays dry.
Good girl, Pips.
An excited Pippa is ready to go home. And little Harry and Mum Vicky can't wait.
You nervous?
A little bit.
She'll be fine, don't worry. She'll be fine. She'll be all better. All her problem will be sorted, okay? I wonder where she is.
We're going to pick Pippa up today and I'm really excited to see her again. When we get her and go home, I want to just play with her and be happy that she's back.
Pippa, who's that?
Hello.
There you go.
Hello. Hello, baby. Hello.
I'm excited to see you.
Hello. We've missed you so much. You've been a good girl. Yeah.
So Pippa's been doing really well since her procedure. We haven't noticed any dribbling in her kennel. Her bedding's been nice and dry, and she seems really comfortable. So really good signs. Yeah, really pleased with how everything went.
It's great. Thank you so much.
Yeah, you're welcome. Not at all. It's a pleasure.
Oh, come on. Thank you so much. I'm so pleased the procedure's all done and we can enjoy her and hopefully no more problems. We can enjoy our little dog. Oh, good girl.
How you doing?
Hey, good. How are you?
Isn't it?
Yeah, Alex.
Chris, how are you?
Nice to meet you.
Come on through, mate.
Chris is in Cairns helping out at the Marlin Coast Veterinary Hospital. And today his first patient is an unusual one.
What is in the bag?
It's a bit of a special lizard, a bit of a surprise for you. They're quite an endangered species and we're part of a breeding program for them here at Cairns Tropical Zoo.
Okay.
Well, I heard that Chris was in town, so I brought in something a little bit different, a little bit rare, so I think Chris will be quite excited to see it.
Wow.
So this little guy here is a Fijian crested iguana.
Yeah. I've been to Fiji a lot of times, and these guys, I know they're in a lot of trouble, aren't they?
They are, yeah. Their population is quite low. They've only found on a couple of islands around the Fijian archipelago.
Yeah.
This little iguana has been named Aku after a Fijian sporting star.
So what's what you're worried about him?
Well, his appetite's gone down and he just hasn't been himself lately.
So just not as energetic?
Basically, yeah, not as energetic. Hasn't been eating as much as he normally would and nowhere near as active as normal.
It's a tricky one. Can I just get your hole in there? I'm just going to get my stethoscope. Fijian crested iguanas are one of the rarest creatures in the world, so you have to make sure that each and every one of them is healthy and hopefully able to breed. But right now, the thing that's caused this guy to be off colour is a complete mystery. It all sounds fine. Both heart and lungs, all normal. Look, the fact that he's not eating like he should makes you think that it's got something to do with his digestive system. So, you know, if we can really focus our search around his abdomen here, the thing is, he feels a bit tense. You know, if anything, when I do push in there, he takes a little gulp and then all of a sudden he isn't so active. So there's some discomfort coming in here. And certainly he's what we call guarding. He's really trying to protect that belly of his.
Yeah.
He hasn't changed his diet at all?
No.
I'm at a bit of a loss to explain why he's showing the signs he is. I think probably the best thing to do right now is take an x-ray.
Okay.
If we do that, we'll get a good look, I guess, you know, inside that abdomen of his and just see if anything's bubbling away there.
He's a cool iguana. I've been working with him for probably the last, coming up to 8 years now. So I guess grown up with him a little bit and got a bit of an attachment to him. So it's concerning to hear there could be something wrong going on in his abdomen. So hopefully we can get to the bottom of it pretty quickly.
He just cannot take his eyes off me. It's kind of mutual.
At the Marlin Coast Veterinary Hospital, Chris is trying to work out what's wrong with Aku, an unwell Fijian iguana.
It's hard not to be just a bit mesmerised by the sight of him. I mean, these are one of the rarest and most endangered iguanas or lizards, really, anywhere in the world.
Chris is x-raying Aku to try to work out why the extremely rare iguana has suddenly lost his appetite.
All right, what's that?
X-ray.
Wow, that's not what I expected. This isn't a digestive problem at all. This is something completely different. I take one look at Aku's x-rays and straight away the weight lifts off the shoulders. It's there in plain sight. Aku has a bladder stone and a large one. But now comes a bigger concern. How do we get it out? That would hurt. There are a couple of ways that you can get a bladder stone. Certainly it can be a metabolic thing where you actually produce too many minerals and it starts to form a crystal, and a really big one at that. Or it can be a dietary thing, or it can be the result of infection. But the reasons why don't really matter so much right now, do they? No. So that's got to go.
Aku's keeper Alex is anxiously waiting for news.
My concern is with Aku, that they are an endangered species. There's not too many of them left, so each one is very precious to us.
All right.
How do we go?
I've got some news that you're probably not going to expect. He's actually got a massive bladder stone.
Oh, really?
Yeah.
Yeah, right.
So, I mean, I've never seen one of these before in an iguana. I mean, it is, we're talking, that large.
Really?
Yeah.
Wow.
So, that would be the reason why he's been a bit off. He's carrying around probably about 30 grams of stone in his belly.
Yeah, right.
When I tell Alex, his face is one of slight confusion because he's not really sure whether he should be relieved or concerned. It's good news that it's not cancer, but at the same time, it's a worry, the fact that now Aku is facing major surgery.
So what's the next step, I guess?
You can try to dissolve these stones, but it will take many months. I don't think that's really fair on him to put up with the stone for all that time. The best thing to do would be to operate. Actually go in there surgically and remove that stone.
Okay.
So that's all right with you. We can do that today for you.
That'd be great. Yeah, I think the sooner it's done, the better, really.
Yeah.
Isn't it?
When you have bladder stones this large, you're talking about quite significant pain and usually quite significant infections as well. So for those reasons, I don't really want to delay on this. It's important we get Aku into surgery straight away. Cool, man. You come with me. All right, lights are on. Okay.
Come on, little one.
So we'll try for the tail vein here.
Yep.
In Cairns, Chris is starting surgery to remove a massive bladder stone from little iguana Aku.
Feeling really sleepy now?
I'm about to operate on one of the rarest animals in the world. An animal that is notoriously difficult under anaesthetic, an animal that is quite old, and an animal that has quite a significant medical problem. Yeah, you can understand why, right now, I'm a bit concerned. The plan really is to cut down through the skin, through the abdominal wall, and my thinking is straight after that, I should find what I'm looking for. All right, I'm now pretty happy with this opening incision. This isn't a situation where I have to go searching for what I'm looking for because it's right there. That bladder stone is just dominating Aku's abdomen there. If there's any doubt as to whether that's it or not, that settles it. It's not called a bladder stone for nothing. It is rock hard and it is made of one big lump of crystal. It's heavy and you just know it'll hurt like hell. For all those reasons, this lump has to come out now. So believe it or not, that is the bladder, but the bladder is totally full to the brim with rock. It's just all bladder stone.
The challenge now is to get the stone out safely.
So my hope is I can actually pull this bladder out and get it on the outside of the body. And maybe a dream. It's not really playing ball. So with any luck, if I can get these in the right place, we might just have some action here.
In Cairns, Chris is trying to remove a massive stone from the bladder of a Fijian iguana called Aku.
It is egg-shaped, so I'm just trying to roll it over so I get the narrowest part. Try to squeeze it out. There we go. There it is. One big stone. Massive. Extraordinary. Living with that just had to be a nightmare. It's essentially made of minerals like calcium and phosphorus and magnesium, and they all bond together and form this rock. You can't imagine the pain and discomfort that Aku has been experiencing up until this point. If Alex hadn't picked up on those subtle signs that Aku was showing, then his life would have continued to be absolute torture.
Alright, let's give this a big flush. The worry we have is that because that bladder has been opened, and we know that bladder is full of bacteria because it's had the big stone in it, the concern is we can now spread that bacteria into Aku's abdominal cavity.
Any more?
No, that's good to start with.
Now Chris can start stitching up Aku's bladder.
This is really, really finicky. Everything is now shrunk down to that stone's gone, so it's absolutely microsurgery. That's the bladder now. I'm happy with how that's looking.
Finally, Chris can close up the wound.
This is just some antibiotics and just provide a bit of an extra barrier to any infection taking hold. Okay, my Fijian friend is done, so it's time to wake him up. Crystal, he's the same iguana, isn't he?
Yes.
He looks very different. Change colour, buddy. What was that all about? What he's done is, because he's been on his back and under anaesthetic and getting cold, he's decided that if he darkens himself up, makes himself black, then he absorbs more heat. It's just one of those incredible adaptations these guys have. Okay, buddy. You ready? There we go. Oh, no, you can't leave yet. No. No, you really can't. I know you think you're ready, and I appreciate that, but you're not. So let's just take it slow. You would never know that this little guy has just experienced major abdominal surgery. He's up, ready, and keen to get moving. It is unbelievable. You are fiery, aren't you? Alex is going to be here soon, so if you put on this sort of display, we'll be very impressed. But for now, just rest, huh? Hey mate, how are you?
Not too bad. How did you go?
Good. Yeah, it's been quite a day for everyone. But he, look, he's just taken the no frills approach to it. He's unmoved, but you can see that's where we went in.
Oh, yep.
Just in there.
3 hours later, it's time for Aku to go home.
He should recover pretty quickly. That area tends to heal up beautifully.
Okay,
so
awesome.
After a few days, you should start to see that appetite of his returning. He should be a lot brighter than he was before.
Yeah, great.
He doesn't have that big rock sitting.
Be a lot more comfortable for him.
Yeah, for sure. Yeah. Okay, but look, he's bounced back incredibly well after the anaesthetic.
Yeah, awesome. Couldn't have gone any better then.
Yeah.
It's great to hear that the surgery went well and the bladder stone was removed successfully, and who knows, maybe he might be interested in breeding now because he is an endangered species, so each and every one of them is very important.
Let us know how he goes, mate.
Yeah, will do.
If he starts fathering some, we should know about it.
Yeah, thanks so much.
Okay, no worries, buddy. I'll put him back in here.
It's a special day when, as a vet, you get to treat an animal that hopefully is one of the cornerstones of preserving an entire species. But today has been that day. Aku had a unique problem, but thankfully a problem we're able to fix, and hopefully now the rest of his life involves producing many more Akus.
In you go.
Hello, Joyce. Can you out?
Very good, Jules.
Is it Toots you've got with you?
Yeah, Toots.
Oh, you to see Joe, is it?
Yeah. He's just a big softie at heart. Yeah, we've had him now for 8 years and he's been a big part of our life.
Lately, Joyce's companion has been suffering a painful bladder infection.
He's uncomfortable when he's passing water and he goes off his food and he ends up with a temperature. Just hope that there's nothing too drastic.
Hi, Joyce. How are you?
Hello there.
Hiya. Do you want to come on in?
Yes.
Vet Joe is part of the small animals team and has been treating Toots with antibiotics. But the infection isn't clearing.
I can feel he's a bit tender still when I feel on his bladder. So definitely that's still the area that he's sore in.
Yes.
We were a bit suspicious there might be something else underlying, that's causing these infections to recur. I think what we need to do now is just take it to the next sort of stage of diagnostics, so to try and work out what's going on. And the best thing for that is going to be to do an X-ray.
Okay.
And go from there then, all right?
All right. You're going to behave yourself. Are you? Okay. See you later, baby.
Brilliant. Good boy.
There's a good boy. I'm just hoping that they don't find anything drastic. So you think the worst all the time, don't you? So we've just got to wait and hope for the best. And that's what I'm doing at the moment.
Good boy. Hi, Lauren. This is little Toots.
Hi, handsome.
Vet nurse Lauren will be assisting Joe with the X-ray of Toots's bladder.
One of the concerns would be bladder stones, so crystals or little stones that form in the bladder itself. It could be a bladder tumour. Obviously, that would be sort of worst case scenario. But really, we need to rule out the stones as a priority. Oh, my goodness.
Oh, wow.
I think we can see what the problem is. So that's his bladder there, then.
Yeah.
And my goodness, can you see how many stones he's got in?
There's tons.
In the Welsh town of St Clair's, local vet Joe and nurse Lauren have discovered the source of 9-year-old Toots's bladder infection.
1, 2, 3, 4. I can't even really count them, to be honest. It looks like gravel. It's full of stones, much more than I'd anticipated, really, and definitely why he's had so many infections and also why he's been so uncomfortable, the poor boy. I just stuck to the bladder wall. And then there's a couple, you can just see a couple more just in his urethra coming out there.
Bladder stones are caused when high levels of minerals build up in urine, forming painful rock-like crystals.
When you've got an awful lot of them, any little bits can go down into the urethra and get stuck. You can actually get a blockage in the bladder, and that's much more of a concern. Hi, Joyce. Do you want to come on through? I just
Left untreated, the bladder can rupture, which can be fatal.
He has got quite a lot of stones in his bladder then.
Right.
Yeah.
So what's the next stage now?
I think they're quite small, but because there's so many of them, I think the only thing we can do is surgery.
Right.
Go in, flush the bladder through and take them out.
How soon are we looking at?
I think we can do it today. Yeah.
Right,
Straight away now. Sooner the better, really.
Yes, because he's
it.
feeling it, aren't you, baby?
Aww.
With so many bladder stones to remove, Scott will return to the practice to help Joe with the surgery later today.
I think Joyce is quite anxious, obviously, especially now that we need to go to surgery. But I think part of her, she knew there was something else going on, so it's a relief sometimes just to get a diagnosis. And hopefully this is something that we can control.
Okay, be a good boy. You always will think the worst, and there's nothing you can do about that. So just go home now, cup of coffee, and start chewing my nails. See you later, baby. Bye. Hopefully, this will sort it out now.
Scott has arrived back at the practice to help out with little Toots's surgery.
Hey, Joe.
Hiya.
What's happening?
This is Toots I chatted to you about. So we've just done the X-ray. Bladder's full of stones.
Ooh,
Yeah,
no.
poor little man.
So just like 1 or 2 stones?
No, literally looks like sort of 30 in there, I think. So the more help, the better to get them all out, I think.
No worries. Okay, well, I'll go and defarm and I'll be back in a sec. See you in a bit.
Lovely.
Nurses Lauren and Sherry are helping Joe prepare 9-year-old Toots for his operation.
So the aim really is to remove all stones or as many of them as we can. So what we're hoping to do is just go in, assess the bladder, remove the stone and flush out any of the smaller ones. I think we're ready to start.
Right, finally, I'm in a uniform that I feel a bit more regular in. This is my normal job.
It's going to be quite nice having an assistant, I think.
All right, let's get those nasty stones out, shall we?
Expecting the bladder wall to be quite thickened as well if he's had the stones in there for a little while. You can just see his bladder there.
Yep.
I can feel a stone just under my finger, actually.
No
just
way.
there.
Can I have a feel? Oh, wow. It is like a bag of gravel. Yeah.
Poor little boy.
Yeah.
So there's the bladder.
It's very angry and inflamed, isn't it?
Yeah.
It is certainly a very irritated bladder, and it's because of the stones within.
And how big were these stones looking?
They weren't looking very big, but there's quite a lot of them. So I think if we start with a small spoon, and then if we need to, we might need to get the bigger one in just to see if there's any bigger bits in.
Normally, when you remove a bladder stone, it's a nice, round, smooth rock, really. It's like a pebble.
There we are.
Wow.
These ones, however, are very harsh, they're very sharp, and they're deeply embedded into Toots's bladder wall.
Nasty little suckers, aren't they?
It feels like there's quite a few more in there as well, I think.
Whoa,
That's a big one.
He's a big one.
They felt like they were a bit deeper down.
Today, he's working with local vet Joe on an urgent case.
Wow.
Goodness me.
Look at that.
Looks like a little hedgehog, doesn't it?
It does.
They are removing 30 painful bladder stones from 9-year-old Toots.
The more we scoop, the more we find. It's incredible. They just keep coming and coming, and they're really angry, sharp-looking stones that are getting stuck into the bladder wall and really causing irritation to poor Toots.
And I think it feels like there's quite a few more in there.
Poor boy, he must have been in some discomfort with those.
You can see why it's inflamed all the bladder wall so much, can't you?
As a boy, passing those types of nasty stones, ouch.
Oh, there's a whopper.
We were expecting quite a few stones, but there's more here even than I thought there might be. They seem to be never ending. 27, and I think that's 28.
28.
Yeah, goodness
Wow.
me. And some of these look like sort of, 5 or 6 joined together to make a big one.
That's a lot of bladder stones.
And still a few more in there, I think.
Right, so do you feel confident then that that's the last one?
Yeah, I think that's it. 2 more from that last flush, so that brings us up to 30.
Look how chuffed you are getting that right on the X-ray. Very impressive.
We removed all of the larger stones, and I think it's the biggest haul I've had from a bladder so far.
All right, let's close this boy up.
Lovely job. It's going to be a bit of a recovery because there's obviously so much swelling and inflammation on the bladder wall. It's going to take a little while for that to settle down, but he should make a full recovery. Thank you very much for your help.
Oh, more than happy to do so.
Joyce is on her way to the practice after a long night missing her beloved dog.
I'm back to pick Toots up after his operation yesterday. So, big smile on the face today.
And it seems little Toots is just as excited.
Feeling better? Oh, good boy. Should we go and see your mum? Hey, who's this then? Ah, who's this? Pleased to see you, I think. Oh, good boy.
You don't know how happy I am. No, it's a really good feeling. Can't stop smiling now that I've got him back. You heavy little monkey.
I know, I think he's put on weight. He's done so well. He's really bright this morning. He's really happy. Doesn't seem uncomfortable at all, so...
You're not going to talk to me, are you?
No.
It's all over and done with. Just want to get him home now and cuddles on the sofa tonight, and that's it. Come on, there's a good boy. Going home now, aren't you? Yes, you are. Come on, dear sweetheart. Come on.
Kate is about to make a house call on a very common pet with an uncommon problem.
Today I'm seeing a really interesting little patient. He's probably not as furry as the usual patients. However, he's still super cute and going to be super interesting.
Hey, Dr. Kate. How are you?
Hi, Schnitz. Schnitzel's like, what are you doing at my house, Dr. Kate? It's not even about you today, Schnitz. Hello, buddy. I know Talia because I also see her dog, Schnitzel.
Oh, you're shaking, but I'm not going to do anything to you today, I promise.
Today isn't about Schnitty.
It's not about Schnitty.
Because you've got a Dougie problem.
We have a fish problem. Dougie, my goldfish, has been lying on his side.
Will he swim to the top?
He has not swum to
Okay.
the top. He's flapping, he's trying. You see a fish on its side, you assume that it's on its way out. It's not pleasant to see Dougie lying on his side. You know, when you have a fish that swims around a lot, the hard thing for me is not knowing if he's in pain. I don't know if he's suffering.
What have you done so far in terms of your treatment to date?
We cleaned the tank.
Yeah.
We have minimised how much food we've been giving him.
Okay.
Got 2 little ones.
Yeah.
Sophie and Redleaf. And they seem to be fine. We don't want to see him like this. That's the problem.
Yeah. Oh, Dougie, you're in such a sorry little state down there, aren't you? What we've probably got here is either a water quality problem or we've got a swim bladder problem. Now, goldfish have this organ called a swim bladder that affects how they float and how they right themselves. And just looking at Dougie, he looks to me like he's probably got something wrong with his swim bladder. When there's not enough air in the swim bladder, it means that they're going to sink. And that could be because there's some kind of a tumour in there, it could be bacteria, it could be because it's blocked. He's a cute little goldfish, and he's a well-loved little goldfish.
Yeah.
No matter what happens today, I think that he deserves a little bit of dignity.
Okay.
It might be that potentially we do have to put him to sleep.
Okay. I think we'd be quite upset if he died. Obviously, we understand that goldfish can't live forever, and, you know, we think at 2.5 years we've done pretty well to keep him alive. But it'll be sad if he doesn't make it.
I'd like to take Dougie with me so I can get an X-ray.
How do you X-ray a goldfish?
What I'm going to do with Dougie is I'm actually going to put him under an anaesthetic.
Okay.
So the way that we anaesthetise a fish is that we put them in water with medication in it. So there are a few risks involved in that. But saying that, I think it's worth it. You know, like, he deserves a chance. Poor Dougie. Okay, Douglas, let's get you off to the clinic. I don't know that I can fix him, but what I really think that I need to do for Dougie and for Talia is to give them some kind of prognosis. Bye, Schnitty. See you later, Gator. Bye. We're going to just figure out how much anaesthetic to put in here.
Back at the Bondi Veterinary Hospital, Kate's preparing to X-ray Dougie to see if there's a clear anatomical problem that's causing him to sink.
So here's the plan. I'm going to put this anaesthetic in. And then we're going to wait about 3 minutes. And then what we're going to do, we're going to get Dougie out super quick and take an X-ray and then put him back into a clean tank. Okay. It's really important that we get the right amount of anaesthetic to put into the water, because obviously if we do too much, we could definitely lose him under anaesthetic. We only have a very small amount of time to do this. We need to get Dougie back into that water as quickly as we possibly can. X-ray. I'm just looking at Dougie's X-rays now, and what I'm seeing is very interesting. This little very important structure filled with air is Dougie's swim bladder, vital in keeping him able to move around freely in his tank. As soon as we look at the X-ray, we can see he's only got one of them, and he's supposed to have two. And what that means is that he's not able to take in enough air to sustain his buoyancy. That's his dorsal fin here. Give him an injection. Sorry, Dougie.
Because of his birth defect, Kate must now find a way to fix Dougie's one and only swim bladder.
So I gave Dougie an injection of antibiotics. I'm hoping that if there is an infection down in that swim bladder, that we can actually move it. The second thing I did is I just put a little bit of air into Dougie's esophagus so I can see if I can inflate that swim bladder a little. And Dougie can get better and he can start to swim on his own.
Kate has one more unconventional treatment to refloat Dougie's ailing swimming career.
This is a packing peanut, and it also is very useful because it floats. And what we're going to do today is we're actually going to attach to Dougie this little peanut so that Dougie is going to be able to get to the top a little bit easier.
If I put my finger through
Yes,
there,
that would be ideal. I don't actually know if this is going to work, but everything's worth a crack. It's very fiddly. You'd have a sore back if you worked on fish all day, wouldn't you?
Yeah.
Oh. So this is going to give Dougie a little bit of mobility, or at least that's what I'm hoping it does. Okay, Douglas, let me just grab the end.
Okay.
Yep, great. So you can already see, like, Dougie's going to be like a normal fish. He's just got a disability.
It's so cute.
I feel like it's going to give him some freedom. My main aim for him is I just want him to have a good quality of life. When it comes to goldfish, there is no real instruction book, so it's a lot of common sense and trial and error.
Kate's unorthodox life jacket soon has Dougie up and about again.
Thanks! Look at him go! He's gonna love it. Look, he's like a normal goldfish, right? What I'm hoping is that when he gets home, this little floaty is gonna make life so much easier for him. All right, Dougie, ready to go home?
In Bondi, Kate's returning goldfish Dougie to owner Talia.
Hello again. Welcome
Hi,
back.
everybody. I'm back. Hi, Schnitty.
Come on in.
Guess what? I've got Dougie back. So first things first, we should probably get Dougie back in his tank, right? Before we have a chat.
Yeah. It's good to have Dougie back. So I was not expecting to see him again. So Dr. Kate's done an amazing job and hopefully he's on the road to recovery.
What's that on his back?
This is what I call Dougie's life jacket.
Okay.
Gives him some buoyancy.
Yeah.
And it obviously takes him up then to the top, and it means that he can get around like a normal fish. Look at him go! He's happy. That was like a happy fish. He's like having a party in there.
I've never seen him like this.
And he can happily live like this for as long as you would like him to live like this.
Yeah. We're really excited to have Dougie back in the family home, and with Dr. Kate's extensive routine, hopefully Dougie will be able to be himself again.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.